Welcome to this explainer. You know, there's this massive misconception that a stroke is just a random lightning bolt out of a clear blue sky. But the shocking reality? Most strokes are entirely predictable. In a huge number of cases, your brain actually gives you a literal 72-hour window to stop a stroke before it ever strikes. Today, we're going to decode those hidden warning signs so you can actually protect yourself and the people you love.
Let's start with a serious reality check. By the time I finish this exact sentence, someone on this planet just had a stroke. It happens literally every 40 seconds. Worldwide, we're talking about the second leading cause of death and the #1 reason people end up with permanent disabilities. Every single minute matters. But to figure out how to beat that clock, we really need to look at what's actually happening inside the brain.
And that brings us right to the two main types of strokes. You've got hemorrhagic strokes, which make up about 15% of cases. That's when a blood vessel actually bursts. But if we want to talk about beating the clock, we really need to focus on the massive 85% majority. Those are ischemic strokes. Basically, a blood vessel gets blocked, totally cutting off the fuel line to your brain. And remember, your brain is a highly demanding control center. It hogs 20% of the oxygen you breathe and demands a constant, uninterrupted supply. If you cut that fuel line for even just a few minutes, cells start dying permanently.
Which brings us to the ultimate fire alarm, the TIA, or transient ischemic attack. Think of your artery like a pipe that's slowly narrowed over the years because of plaque buildup. During a TIA, that tight vessel briefly spasms, or maybe a tiny clot gets stuck. The blood stops, a part of your brain essentially blacks out, and you get a temporary stroke symptom. But then, the spasm relaxes, blood flows again, and the symptom just fades away. People brush this off, but research shows this is your final warning. It usually warns of a massive strike coming, typically within the next 72 hours.
So let's jump into section 1, the 5 red flags, and why you absolutely need to listen to your brain's warning shots.
Here's a quick overview of the 5 red flags we're going to decode today. The tricky thing about these episodes, they slip right through the cracks because they usually last anywhere from just 30 seconds to maybe 10 minutes. You could just be standing in the kitchen or getting out of your car, and by the time you actually stop to think about it, the symptom is completely gone. But make no mistake, each of these is a clear message from your brain shouting that it is about to be in serious trouble. Let's start with the one neurologists treat as an absolute drop-everything emergency.
Imagine suddenly seeing a black curtain fall over just one eye. Or it looks like someone smeared your eye with gray mud. That's our first red flag, amaurosis fugax, or fleeting blindness. You might rub your eye and a minute later, boom, your vision is back. It's so easy to blame screen time or standing up too fast, right? But in reality, a tiny clot broke off from your neck artery and plugged up the tiny artery feeding your eye. And the terrifying part? You were actually lucky. That exact same clot could have moved just 2 millimeters over into a brain artery, causing permanent paralysis or even worse.
Let's look at the second sign, which is a sudden case of what we call drunk skin. Now, if you wake up with a numb arm because you slept on it weird, that's just normal nerve compression. You shake it out, blood flow normalizes, you're totally fine. But TIA numbness is a whole different beast. It happens completely out of nowhere, like when you're just sitting on the couch. It feels like rubber or intense pins and needles on exactly one side of your body. Why? Because the glitch isn't actually in your arm. It's a glitch in the specific area of your brain that maps sensation for that side of your body.
The third flag is what we call the drunk walk. Picture this, you're walking on a perfectly flat surface and out of nowhere you just stagger into a wall, or you feel violently dizzy without even turning your head. This happens because of a sharp drop in blood flow to the cerebellum. That's the small, sort of extra brain at the back of your skull that handles all your smooth coordination. A lot of people will write this off. They'll say, oh, I just have bad shoes on, or I'm just exhausted, only to find out later it was actually a massive vascular warning.
Now, it's really fascinating how our fourth sign, a speech breakdown, shows up in two very distinct ways, depending on which part of the brain is starving for fuel. If Broca's area is affected, you know exactly what you want to say, but the words come out slurred, chopped up, or you just get completely stuck. But if Wernicke's area takes the hit, you might speak fluently, but you're saying complete nonsense. It's a total word salad, and you might not even understand what people are saying to you. Look, if your home fire alarm goes off and then stops by itself, you wouldn't just assume everything is fine, right? The same goes for broken speech. Oh, and before we move on, do not ignore that fifth sign from our list. Unusually severe, brand new headaches, especially if you have an autoimmune skin condition called vitiligo. When those two show up together, it's a huge indicator of deep, dangerous inflammation in your blood vessels.
All right, moving into section 2, the root causes and exactly what is wrecking your arteries.
The absolute crucial point here is understanding what sets the stage for these clots over the years.
Think of the inner lining of your arteries, the endothelium, like a brand new, super smooth non-stick pan. When it's healthy, blood just glides right by. But things like chronically high blood sugar from prediabetes or the toxic chemicals from smoking, they essentially scratch and inflame that pristine non-stick surface. It gets all rough and scarred. Suddenly, cholesterol and sticky platelets have the perfect little landing pad to cling to, and they start growing into the plaques that eventually block your brain. And hey, how old are you right now? Because once you hit 40, this specific kind of damage happens twice as fast as it did in your 30s.
There's also this incredibly dangerous, often ignored paradox when it comes to blood pressure. Now, obviously, chronically high blood pressure is terrible. It physically stresses your vessel walls and speeds up that plaque buildup. But here's the twist. Ischemic strokes very often hit at a relative low point. At night, while you're fast asleep, your blood pressure naturally drops by about 15 to 20%. If you have an artery that's already squeezed incredibly tight by plaque, that perfectly normal nighttime pressure drop can be enough to suddenly halt blood flow completely through that tight spot. That is exactly why so many people go to bed feeling completely fine, only to wake up having had a stroke.
Which brings us to Section 3, your 72-hour action plan. Let's cover what you need to do immediately. The second you experience any of those 5 warning signs, that 72-hour countdown officially begins. Let's walk through these vital immediate steps. First up, do not be alone. If a full stroke hits, you need someone right there who can call emergency services. Second, absolutely do not drive yourself. Losing your vision or arm control for even a split second on the highway is completely life-threatening to you and everyone else on the road. Third, check your blood pressure. If it's spiking above 180 over 110, you are in a crisis that requires an immediate emergency call. And finally, while you're waiting for help to arrive, lie flat on your back and slightly raise your legs. This can actually help use gravity to support blood flow right back to your brain.
Now, I know in a moment of panic, it might be super tempting to just reach for an aspirin, but you must never, ever self-medicate if you suspect a stroke. Here's why. An ischemic stroke is a blocked vessel, so yes, blood thinners might help. But a hemorrhagic stroke is a bleeding burst vessel. If you take a blood thinner during an active brain bleed, it can turn fatal incredibly fast. Literally, the only way to know for sure which one is happening is by getting a CT scan at the hospital.
All right, Section 4, 3 vital medical tests. Let's talk about decoding the threat. Okay, so once you're safely at the doctor, do not just let them wave you off with a simple, well, everything looks fine. You need to specifically ask for 3 evaluations. Test number 1 is the carotid duplex ultrasound. This isn't just your basic ultrasound. This specialized scan shows exactly how fast your blood is getting turbulent or struggling through the narrowed segments in your neck. If it uncovers more than a 70% plaque blockage, doctors can perform a routine, modern surgery that literally scoops that plaque right out, saving you from a guaranteed impending stroke.
Next up is the HbA1c blood test, and this one is absolutely critical. It doesn't just take a single random morning snapshot of your fasting blood sugar, which, let's be honest, you could easily gain just by fasting. No, this exposes your true average blood sugar over the last 3 months. It is exactly what catches that dangerous gray zone of prediabetes, where elevated blood sugar has been quietly scratching up your non-stick vessels for years before any doctor officially slaps a diabetes label on it.
Finally, we have the Holter ECG monitor. A quick 10-second scan in a clinic just isn't going to catch everything. The Holter is a 24-hour wearable device specifically designed to catch hidden, swirling episodes of atrial fibrillation, or AFib. When you have AFib, the top chamber of your heart quivers chaotically instead of giving a nice, smooth beat. That makes the blood churn and swirl, forming little clots that can shoot straight up your neck and into your brain. Catching this early and getting on the right anticoagulants can actively slash your stroke risk by up to 70%.
So, what's the big takeaway from all this? We've seen today that strokes absolutely do not just strike out of nowhere. They are the highly predictable endpoint of years of silent, compounding damage. And very often, they send incredibly specific, undeniable fire alarms right before the main event. You now know exactly what those red flags look like, what causes them, and the exact tests you need to demand to protect your future. So I'm going to leave you with this final, vital question. If your brain gave you a 72-hour warning to save your own life, would you listen?